let's go forward. Pharmacogenomics is also an important thing in the drug development, because you mentioned that we are different. We are different individuals, and we have a different response for even the medicines or even for natural products, because we have different enzyme activities, we have different biological pathway inactivities. Some people have some lack of enzymes. Maybe those who have lactose intolerance, this is one of the frequent problems. These people have no lactase enzyme and they are not able to digest the milk sugar, or we can say other examples. And even we can have different capacity to digest, we have capacity to metabolize or even excrete the drugs. And this is determined by the genes. So basically, these group of persons have the same disease, the same diagnosis, and they get the same medicine. But majority of them have a good response for the drug and no toxic effect, no intolerable side effects. But there are few of them who have no toxic effect, but even no effect at all. And there are some other portion of these persons with the same disease and the same diagnosis and the same medication, that they have only good, but they have benefit in the action, so the drug is effective in their bodies, but it's toxic, they cannot tolerable. And here are the losers who have any good response for the drug, but it's toxic. So this is the worst. But they have the same problem, and they get the same prescription, but they have different responses. And this is caused by the genes, because the level of absorption or intensity of absorption, distribution, metabolism, excretion is determined by our genes. Even how the receptors which are catching the drugs in our body are working is determined by the genes. And even what happens inside the cell, because there is a secondary process when we stimulate a receptor. Inside the cell, there are many steps, many pathways are activated, but the activation way and the activity of this activation is also determined by the genes. So if you have different enzymes, you will have different response to the drug. Usually, the majority of the people can be put in the extensive metabolizers, which have a normal activity, for example, in the enzymes, which are eliminating the drugs from our body. There are some persons who have an intermediate metabolizing activity. This is not a huge difference, so maybe these persons have a good response for the drug. But if somebody have a rapid metabolizing capacity, it means that the drug will be eliminated very fastly from the body, so there will be no response because the drug cannot reach the effective level in our body. And there is another portion who can be very poor metabolizers. There is no real good metabolism for the drug. It means that the drugs will be toxic very quickly because there is no elimination. They get the same drug, but their enzymes are different. And this is determined genetically. So that's why pharmacogenomics is important. So this is an ideal thing, what I show you. But if we can individualize the therapy for the enzymes, what we have, but it takes lots of money because all individuals should go to the hospital and clinics and get a genetic map and investigating that those enzymes which are important for the drug metabolize, how these enzymes are working. And it's huge money, but there are some, this is maybe, okay, electricity. But I know, for example, in Holland, there are several clinics where they can do it, these individual therapies. So they are checking the status, the metabolizing status of the patient, and they choose the drug and the dose of the drug that is necessary for the patient. So recently, in a general clinics in the world, maybe all the patients with the same disease are treated with the same way, but if we can determine, if we have enough money in the health system, for example, we have no hope in Hungary to do this even for decades, but if we have enough money to check how the enzymes are working individually, all the patients can have a good response to drug. This is the importance, this pharmacogenomical approach. Okay, any question to this pharmacogenomical part? No question. Okay. In the next, I would like to tell you some interesting things. Maybe some parts was boring now, but it will be interesting, I hope. Because I would like to show you a few medicines which are natural, but we are taking in tablets. Because you will see that many of the drugs what are used today comes from the nature. And do not believe that if a drug is made by an industry, it's just artificial. Because the main ideas, usually the good main ideas, comes from the nature. And I can tell you, comes from God. God created the basic molecules, and we got the knowledge a little bit alter them if it is necessary. Maybe you think that it's not so good because natural is natural, but I ask a question that if you think that to eat flakes, cereal flakes is healthy, I think it's an Adventist product. The corn flakes, it's an Adventist product, and we say that it's healthy. I ask you that cornflakes is natural because it's from the nature, but it's not natural because it's a little bit transformed. So that's the way we have to approach the drugs and the molecules. And you will see that the majority of the molecules are natural, but there is a little trick to change something, like a corn is changed to cornflakes. Okay? So, first, what is known everybody is the acetyl salicylic acid, the famous aspirin, which comes from the white willow, the bark of the white willow. It's a beautiful tree. And the Latin name of this white willow is Salix alba, and the part, this bark, in the Latin word is salicylic cortex, and there is a compound in this salicylic cortex, this white willow bark, which got the name from this salicylic cortex, salicin. And salicin is a little bit toxic and hurt your stomach and cause some problems. Here you can see the structure. But with some simple alteration, we get salicylic alcohol and salicylic acid, which is not bad. But if we put some acetyl group, and if you compare this one to this one, it's almost the same molecule, but here is not a glucose can be found, but here we can find an acetyl group. That's make aspirin. And aspirin was introduced in the therapy in 1898. It's more than 110 years old, the drug, and still very good. And this aspirin, this acetyl salicylic acid, has a much stronger anti-inflammatory effect and block the cyclooxygenase enzyme, which produce all the materials which maintain the fever, maintain the inflammation, cause pain. So this acetyl salicylic acid is almost natural, and also it got a new use in the therapy because since the 1950s it is used as a platelet inhibitor to prevent the aggregation of the platelet, to prevent thrombosis. This is a wonderful present from the nature, and this is only a small change, as you see, and we get this new molecule, which is at that time it was new. Of course, it's not new. It's one of the oldest one, but it's still usable and it's still very important in the prevention of myocardial infarction and other diseases. The other old compound, which is known or used. At the time they didn't know that what is the active ingredient, but it was a medical plant. This is the Foxglove. Two types of Foxglove is the lanata, which means woolly, because the plant like a wool covered the flowers, and the other version is the purpura, or the purple one. Digitalis lanata and digitalis purpura, and two compounds, digoxin and digitoxin, which are very important in cardiac decompensations. There was a famous physician, William Withering, who discovered that if somebody drink a tea from this Foxglove, it can recover the cardiac decompensation, it can stimulate the urination, pumping more liquids to the kidneys, and these compounds are always and still used for cardiac decompensation. But the problem is that these compounds are very toxic. So at that time, those patients who use this Foxglove, many of the patients die in intoxication, because the difference between the effective dose and the toxic dose is almost nothing. And to be honest, if digoxin or digitoxin would be started now in a clinical study, it will be never a drug. It's so toxic, the range is so narrow that it should fail even maybe the preclinical phase. But we are still using because it is inside, and we have a very good dosage for it, but of course we have to be very careful, and the patient have to follow a very strict lifestyle, do not change the drugs, other drugs which are eaten together. But so these toxic things can be safe in the form of medicine. It's not safe as a herbal plant, but it's safe as a medicine. The next one is oseltamivir. Everybody afraid from the flu, and you know the first version of this letter flu was the H1N1 influenza virus. The H is the means the hemagglutinin ability of the virus, and the N is reflect the enzyme, the neuroamidase enzyme of the virus. You know, these viruses, these influenza viruses are very tricky because they are invading the cells, and after when they are replicating themselves inside our cells, they are breaking through the cells. So they are released from the cells, and from this breakthrough, from this release, they are need to use this neuroamidase enzyme. So if this neuroamidase enzyme is not functioning, the virus are not able to escape and infect other cells. And oseltamivir is one of the wonderful drugs against this H1N1 influenza virus. But the prototype or the parent molecule which led to oseltamivir is the so-called Shikimic Acid. It sounds like a Japanese word, so it comes from the Asian herb which called star anise, and this is a traditional Chinese medical herb. But very interestingly, the shikimic acid has no antiviral action. It has a herbicide action and also antibacterial action. But this shikimic acid was modified. Maybe they want to reach much better antibacterial action. But this slight, not too heavy modification, this is shikimic acid, and here you can see the shikimic acid structure in the structure of oseltamivir. Here just got some carbonic atoms, and here other carboxyl end, and this makes oseltamivir, which have an other character. It has an good antiviral action. So sometimes it happens that scientists want to increase a given effect, but by the alteration they get another effect, which is, in this case, it's not antibacterial but antiviral, but it's very good. But the basic idea comes from the star anise, and this is shikimic acid. Basically, there is no huge amount of star anise in the world to maintain the Tamiflu synthesis. So therefore, this oseltamivir or shikimic acid is done by bacterial fermentation. So in the bacteria, they put a gene which encoding the synthesis of this compound, and by this way, the compounds should be extracted from the bacteria. The next one is good news for the high cholesterol persons here, because the statins, which are always under debate, they are absolutely natural. This is one of the most natural things. The lovastatin was the first statin in the therapy, and lovastatin came from the red yeast rice. There is a red rice, which is a traditional Chinese food. Basically, the rice is never red, but this redness is given by a special yeast. So this is a fermentation. This yeast ferment the white rice and gives these red colors. But after this fermentation, there is a component inside the red rice, which is exactly the lovastatin. So it was made by the yeast, and it was eaten by the Chinese. Maybe they never checked the cholesterol level, I'm sure, but somehow they found maybe they like the taste, and otherwise they found that it's promote the health, because really itself this red rice can reduce your cholesterol level. And if you see the next drug which was made from lovastatin, which is simvastatin, if you compare this one with this one, there is only one methyl group, which is the difference, no other differences, and we get a more potent and more effective cholesterol decreasing drug. So this is another wonder from the nature, or other wonder from the God word, that basically a small yeast with a rice can produce a drug which can help to lower our cholesterol level. Of course, in this conference, we agreed that to make lower our cholesterol level, we need not to eat cholesterol. That's right. But we also know that there are some diseases, because cholesterol itself produced by our body, or liver synthesized cholesterol. And don't forget, the cholesterol is not the enemy of our body. Many people think that cholesterol is the worst thing in the world, but it's not true, because cholesterol is necessary for the life. Cholesterol is necessary for the cell membrane. Cholesterol, ladies and gentlemen, is necessary for the sexual hormone synthesis. All the sexual hormones are synthesized from cholesterol. Those persons who have lower cholesterol than necessary, they will have or may have sexual dysfunction. Especially the ladies can have some cycle problems, because there is not enough estrogen, not enough progesterone in our body. So cholesterol is necessary, but the too high cholesterol is dangerous. So, and there are some diseases when the liver produces too much cholesterol. It's not depend on the dietary habits. It's not alimentary problem, but this is a liver problem. In this case, this lovastatin is a blessing to reduce cholesterol and reduce the risk for vascular diseases. And here is the cocaine. I mentioned cocaine, that it's very addictive, and we have lots of trouble, and maybe it's causing war in the South American part, but here is this wonderful, wonderful leaves, and even these leaves are eaten by the Indians in Peru. It's not even the World Health Organization accept the coca leaves consumption of Indians in Peru or in Bolivia in high altitude, because cocaine is necessary to help them to work, because at that high altitude, 6,000 meters and above, there is no oxygen and they have to work. And in eating these coca leaves, they don't eat too much cocaine, but it stimulates their body to have a performance for work. It's interesting. So if you want to try legally the coca leaves, you have to go to Bolivia or Peru for the Indians, and nobody will charge you that you are using illegal drugs. But now I want to talk about another character of cocaine, because cocaine is the best anesthetics in the world. The best local anesthetics. There is no other very good local anesthetics than cocaine, because cocaine itself has a good anti-pain effect. Even it is used by ophthalmologists or other specialists who are working on the mucus of the eye or in the ear, because it can cause a very, very, very fast and very prolonged analgesic action, or not analgesic, anesthetic action. We will not feel the pain. And the secret of it, that it's not only have an anesthetic effect, but it can contract the vessels. And by this way, it prevents its absorption from the site of action, and it can remain for a long time at the site of action. And that is the secret of cocaine, that it can act for a long time, even hours. But unfortunately, it's addictive, and some other drugs should be created. For example, here is the cocaine. Here is the structure, and here it's upside down, but it's easier to find the similarities. This is procaine. You can see that this part of the molecule is almost the same. Here is only an amino group, and also there is some part reminding to the nitrogen part. So this is cocaine, and this is the artificial cocaine, but it remains the part, significant part of the cocaine molecule. And why all the local anesthetics is ended to caine? Because of cocaine. Because all the local anesthetic products are reminding us to the first local anesthetics, which was cocaine, and it was used in. So when cocaine was discovered as a local anesthetic, it was a huge breakthrough for ophthalmologists and other therapeutists. So it's interesting, because cocaine is an enemy for us, basically, but we heard that it was in the Coca-Cola, and people drank it and they were happy. And also if we do not drink or do not eat cocaine, we can use it as a topical local anesthetics. And interesting, and all the relatives or compounds is reminding us to cocaine. The next comes from a snake. The captopril is one of the first, or this was the first generation of a new antihypertensive agents. And there is a Brazilian viper, Bothrops yararaca. This is the viper here, and it has a poison, a peptide, which kills you. But you know, the viper venom investigation was and is still is very extensive, and they found that the venom of this viper can block an enzyme in our body. This enzyme has a terrible name, angiotensin converting enzyme. This enzyme makes a compound which is called angiotensin 2, which is one of the most strongest vessel contractor in our body. And if we have too much angiotensin 2, it means that we will have high blood pressure, we will have problem with our kidneys, we will have problem with our heart, so it's a problem. And these peptides, these Bothrops yararaca peptides, these Brazilian viper peptides, blocked these enzyme, and it was very interesting. But unfortunately, if we want to make a good antihypertensive therapy, we have to find a way for drug administration which is safe, and the most safest and most easiest way is the oral administration. But the peptides cannot be taken orally, but all the peptides will be cut by the stomach juice and the small intestine juice, so the peptides never survive this digestion process. Therefore, the scientists start to search that some amino acids, which of course build up all the peptides, and they found that there is many prolines in this venom, and they modified this proline. This is the proline. This is an essential amino acid. All of us have this proline in our body. And they modified this proline. Here is the proline, and they put a strange group on it, and they found that this amino acid, this one element of these peptides, are able to bind to this important enzyme and can reduce the blood pressure. And it will survive all the digestive processes. And this is captopril. So the idea of captopril comes from a viper. a Brazilian viper. And now all the drugs which are acting this way by this angiotensin converting enzyme inhibition are ended to pril, captopril, enalapril, fosinopril, and so on. So if you see a drug ending to pril, it means that it acts on this enzyme. This is also from the nature. A next example, and maybe this is my last example for this drug, is warfarin, which is an anticoagulant drug from the hay of special plants, especially of common melilot, or the other name of this plant is the sweet clover. So it's a common, you can find it in the meadows almost everywhere. And this plant contains coumarin. And this coumarin was used as an aroma enhancer in pipe tobaccos, for example, and it was also added to alcoholic drinks because it has a very good smell. So the tobacco is unhealthy, but to be honest, if I smell that somebody using a pipe, so piping, and the pipe tobacco had a very good smell. I don't know who is agree with me, but it has a very good, it's not the smell of the tobacco, but the smell of coumarin, or no, today not coumarin is used because it's toxic, but the same or the similar smell is given. So it has a very good aromatic smell, and it's okay. It's just a story for the smokers and the drinkers. So what about the lifestyle here? Because coumarin, when the meadow is mown, cutted, and the hay is left there, and it's dried, and of course some microorganisms start to work in this hay, the microorganism can transform this coumarin to decumarol. So this is a natural thing. It takes place on the meadow. And if the cow eating this, or any animals eating this decumarol containing hay, get a bleeding disease. This is called sweet clover disease, and it was described first in 1922. They found that the animals died in bleeding, and they didn't understand what happened with the animals. They just eat them from the meadow, what happens. And finally they discovered that this decumarol is responsible, because decumarol is an anticoagulant. It doesn't allow the blood coagulation, and you got a bleeding. Usually this type of drug is used as a poison for rats or any type of rodent. So if you have rodents at your home and you buy a poison against rodents, this very probably contains decumarols. It's a very good poison for the rats, because you know rats are working with rats. Rats are very clever, very, very clever. And if they get a poison which kills them immediately, only one rat will die, and the others will not even go to the near of this poison. They will not eat, because they saw that their friends died because of the poison. But if you give this decumarol, if you eat decumarol every day or a few days, the animal will die 1 week later, and they have no any association in their mind that it was caused by that food. That's why it's a good rodent poison. So, but I don't want to talk more about how to kill the rats, but let's see that what is the connection of warfarin with decumarol. So warfarin is a slightly modified decumarol, so basically this part of the molecule, or maybe it's very close to coumarin, but basically this part of warfarin is almost the same that the part of decumarol. So this decumarol gave the idea to find a much safer and longer acting anticoagulant agent. And those people who have some problems with blood coagulation get this warfarin, which is originated from the hay. And this is also the story, what I told you, that God gives the wisdom and the knowledge and creates materials, and human get wisdom and knowledge how to potentiate this effect. And this is my last example for this block, because we have to mention that there are a wonderful plant what we have. This is poppy. In Hungary, we eat lots of poppy. Somebody supposed that even the poppy seeds contains opium, but it's basically not true. Believe me, in Christmas time, I eat a lot of poppy cakes, and I never get euphoria and other feelings because of the poppy cake. So you can eat poppy. It's very healthy because in poppy there are lots of iron. If you eat lots of poppy, it will prevent the osteoporosis. It seems to be very good against the osteoporosis, so it's very, very healthy. But somehow it is withdrawn because of the opium, but the opium is not in the poppy seed, but in the outer shell. This is a special knife, and approximately a 1 centimeter wand, 1 centimeter deep wand should be cut on the head of this poppy plant, and the opium will slowly goes outside, and they collect the opium with this special knife, and this is what is dangerous, but not the poppy seed inside. So basically we have wonderful drugs: morphine, codeine, papaverine. These are all naturals. These are all can be found in the opium. Opium is a mixture of a lot of compounds from poppy, and it has been known as a good analgesic and an obstipant even from the old ages. So even the Egyptian papyrus mentioned maybe 70 prescription for pain, and all the prescription contains opium. And also the Arabic doctors discovered that very severe diarrhea can be stopped by opium because it has also an obstipant effect. So the opium is a very old natural raw compound used in the therapy, but in the 19th century scientists start to isolate the compounds from opium, and we found morphine, we found codeine, and we found papaverine, and morphine has a very good analgesic effect. It was the first real drug against pain. Codeine has a very good antitussive, anti-coughing effect. It's excellent, of course. And papaverine has a spasmolytic effect. If you have some stomach spasm or bowel spasm, papaverine can relieve you. And lots of analogs were synthesized and registered from these compounds. Just few examples. Yeah, it's terrible. Here is morphine. Maybe you know heroin because it's a huge problem. If you see what is the difference between morphine and heroin, only the acetyl group here. So if you have morphine and acetic acid at home, and maybe you have vineyard at home, so basically if you are enough smart in your kitchen, you can prepare heroin because you just put some acetic group to morphine and you made heroin. This is very dangerous. So heroin is very addictive. Even after the first use, you can have withdrawal syndrome. So it's an enemy. Morphine is not an enemy. Heroin is an enemy. But here is meperidine, which you can see the morphine structure here. Here is this group here. Oh, it's upside down. So we start here, go down, and here is the nitrogen. This part is here. Here is the nitrogen part. So it absolutely reminds to morphine. And this is a very good another analgesic compounds. Unfortunately, in the opiates, we cannot separate the analgesic and the addictive effect. There was tremendous experiences and trials how to separate, but if a compound has an opiate has a good analgesic effect, it means that it has a very good addictive effect. We cannot separate it. But meperidine is an alternative, for example. Here is codeine. You see what is the difference between morphine and codeine? Here is the methyl group. This is the only difference. Codeine has some analgesic effect, but it's not basically the effect of codeine, but it's the effect of morphine. If you take a tablet of codeine, the codeine will be metabolized in your liver in 10% to morphine, and that morphine will be responsible for the analgesic effect. So be careful if an Asian person comes into your practice, or I don't know how many of you have license to heal, but if a Chinese or a Japanese or a Korean person asks anti or analgesic drug never give them codeine because they have no such an enzyme which transform codeine to morphine in the liver. It's just for the Caucasian race and the Afro-American race, but Asians are not able to transfer it. So for an Asian person, it is pharmacogenomics. An Asian person's codeine is not an analgesic drug because there is no any action. But everybody, for all of us, codeine is a wonderful anti-tussive agent. But if we alter the structure a little bit, not too much, here you can see that instead of the hydroxide, there is this oxo group. We got hydrocodone, which has a very good analgesic action. So it's just simple, like a Lego, put here, put there, and the effect is changing, and it can be beneficial for the therapy. Or here is papaverine, which is a spasmolytic, a natural spasmolytic, and here is drotaverine. The only difference is that here is methyl group, and here is one methyl and another methyl. So that's the difference between the two compounds, but drotaverine has a stronger spasmolytic and antispastic effect, and can be used in many abdominal conditions. So that's the puzzle, or that's the Lego of the molecules, and the basic molecules, the basic idea comes from nature, comes by God, and we just discover some alterations, and we can enhance the efficacy, and we can make the therapy safer. So. As a conclusion, this part, we can say that the majority of the industrial drugs are rooted in natural compounds. So maybe the religion and the science is close to each other. It's a funny cartoon that, for example, even the scientists and even the religious people say that the end is near. So sometimes we find good connections. But really, it's true that Lord gives the wisdom for us. So we are reaching the final part. We are in time because I have to say some sad things about pharmacology. It may be not the mistake of pharmacology, but sometimes even when the intent to find a good drugs is the best, and it seems that everything is fitting, some sudden problems can happen. And this story is about the cyclooxygenase 2 inhibitors. Maybe you heard the story about Vioxx and Bextra and even Celebrex. Celebrex is still on the market, but Bextra and Vioxx were withdrawn. It was happened less than 10 years ago, and these drugs were one of the greatest promises to heal the inflammation, to heal joint pain, to heal all the pains what we have caused by an inflammation. Basically, these drugs were very, very high profit makers, because as you've seen how many $1 billion was the income for the companies, you can see that when I said that drug development takes $1 billion, it means that, for example, the celecoxib or all the coxibs, even in 2000, gave $6 billion. So it was a huge extra profit for them. So it was a good investment. And even in 2003, rofecoxib itself earned $2.5 billion. So it was a big deal for the companies. But unfortunately, these drugs should be withdrawn. These drugs were advertised. These coxibs were the highest advertised drugs in the medical history. Even only just in Canada, 2 million free medical samples were given from rofecoxib and celecoxib. In 2004, even $71 million was spent for the advertisement for celecoxib, and the media suggested that you have this drug is yours. You can say that give my drug, this is designed for this is for my disease. But here is an advertisement. Baxter is born, it's a power, like a matrix, comes, and even famous sports ladies was involved in the advertisement. Dorothy Hamill was an Olympic winner, Olympic champion. She won his Olympic champion in figure skating in 1976 in Innsbruck. And she is very, even nowadays, and very popular in the United States, and very rare that a sportsman can be involved in an advertisement of a medicine. And of course, this also suggests that maybe we know that the figure skaters have lots of problems with the joints. It's a very harmful sport, and it suggests that even Dorothy Hamill have no any pain because she just take this Vioxx. And here also some data. But the problem is that in September 2004, the rofecoxib was recalled because it was proved that it can increase the myocardial infarction risk and the stroke risk. And it was proved that approximately during 5 years, between 1999 and 2004, approximately 1,000 cardiac complaints was caused by the drug, and 66,000 people was died during this 5 years only because of rofecoxib. But if we put all together the number of deaths in the world, mainly in North America, we can say that during these 5 years, approximately 100,000 people died because of the side effects of these coxibs. A few months later, maybe 8 months later, the other coxib, vodacoxib, was withdrawn because of the coronary problems, and it was shown that it's not safe. What happened? It's terrible, I know, at the end of this long workshop, but I have to show you, this is the cascade for arachidonic acid. This is called arachidonic acid cascade. This is a natural compound. All of the cells we have arachidonic acid. This is created by God in our body. And this arachidonic acid is transferred by enzymes. One of the important enzymes is cyclooxygenase. That's why we're using the COX abbreviation. And cyclooxygenase makes many prostaglandins, and I mark the most important character in this story, the thromboxane A2, which is responsible for the platelet aggregation, for prostaglandin E2, which is responsible for pain and fever, and prostaglandin I2, or other name is prostacyclin, which is responsible for the antiplatelet effect. So these are the main rulers. Here is the arachidonic acid, and you can see that here is the COX enzyme, which makes the prostaglandins, and there is another enzyme, which is the lipoxygenase enzyme, making some so-called leukotrienes, which are responsible for asthmatic response, and even they have immunostimulant effect. So the hypothesis was, because they discovered that there are two enzymes, two variations of cyclooxygenase, cyclooxygenase 1 and cyclooxygenase 2. These are genetically separated enzymes. And they supposed at the time, at the beginning of 1990s, that COX-1, cyclooxygenase 1 enzyme is an enzyme which is always working. This is necessary for the normal body function. This is responsible for the gastrointestinal tract work, renal function, platelet function, everything. So this is necessary. It's if we block it, and all the non-steroidal anti-inflammatory drugs like aspirin blocks this enzyme also, so they have some side effects, ulcer, platelet or bleeding, or even some renal dysfunction. These are the side effects. But this COX-2 seems to be activated only in pathophysiological situation, like inflammation, for example. And they suppose that if they can find a drug which can selectively block this second type of enzyme, we can elicit or we can do an anti-inflammatory therapy without side effects. There will be no ulcer, there will be no renal complications, nothing, just pure therapeutic effect. And it was a nice idea. And in the next step, they found the difference between the COX-1 and COX-2, and they found even, this is the shape of the enzyme, this is the cyclooxygenase 1, this is the cyclooxygenase 2, and they found that in their structure there is a huge difference. Only one amino acid is the difference, but it makes a pocket in the cyclooxygenase 2, and there was a possibility to design a drug which docking exactly this side pocket, and it will block selectively this enzyme, but the other enzyme, which is normally necessary, will not be affected. And they did it. They used the computer, as I mentioned it, in silico. They modelized what kind of drugs can be bind to this pocket selectively. And here is some example about the drug. Here is the shape of the enzyme, the target, and they planned and they found and they did it. And they created the COX-IBs. And the next step, how to use it in therapy, because they found that they are safe, there is no problem, even during the toxicity studies and so on. Originally, when the COX-IBs was introduced into the market, they intend to give patients who have no good response for non-steroidal anti-inflammatory therapy, or patients who have some severe gastrointestinal side effects with the traditional non-steroidal drugs, those patients who are older than age 65 because they have higher risk, especially for the kidney problems with the traditional non-steroidal anti-inflammatory drugs, those patients who have to take very high dose of these drugs because of severe joint inflammation or other problems. But practically, when they suppose that there is no side effects, and that's why I told you that there is always side effect. If we think that there is no side effect, it's a mistake. There will be always side effect. So they suppose there is no side effects, no risk, and they said that everybody can take this medicine who wants a safer therapy. If I raise a question, who is here who don't want a safer therapy? I think nobody will raise hand. Everybody wants a safer therapy. Yes, we want a drug which is safe. And that was a huge mistake because, you see, it's a very complicated picture. What are the COX-1 inhibition cause in our body and what are the COX-2 inhibition can cause in our body? You can see that we just simply inhibit one or two enzymes and many response can be created, and one part of the response will be effect, but the other response will be side effect. And here is if we block the COX-2, we can cause a prothrombotic effect. We can increase the risk for thrombosis. So this is a very simple scale showing that how to influence by the prostacyclin and thromboxane A2 balance. So these two compounds, these two products are balancing the thrombocyte, the platelet aggregation. If there is a balance, everything is normal, there is no problem. If we take a low aspirin dose, low acetylsalicylic acid dose, we have to elicit a decrease in the thromboxane A2 level, and by this way, the scale will go to the antithrombotic direction. That's why those who had some thrombosis or infarction or risk of infarction take the low dose of aspirin because it prevents the thrombocytes, the platelet aggregation. If we take a high dose of a non-selective anti-inflammatory drugs, both prostacyclin and thromboxane A2 will be decreased, so there will be no problem. The balance is still exists on a lower level, but there is no problem. But if we take selective cyclooxygenase 2 inhibitors for long term, we will reduce the prostacyclin level. And if we reduce it, the platelets will aggregate, and that's why the people get infarction and stroke, and almost 100,000 people died. Why it is not revealed during the clinical studies? this is a figure showing that as the selectivity for the COX is increasing, it's also increasing the prothrombotic effect. And if the COX-2 selectivity is decreased, it means that there is a good antithrombotic effect. But why it is not discovered? It's a very, very interesting thing, because this table or figure should be terrible, looks like a terrible one, but I tell you what is it. Here are the patients number who were involved in the studies, and this axis shows that what is the favor according to myocardial infarction risk. If the point is on the right side, it means that there is a favor for those who do not take coxibs. If there is a point in the left side, it means favor for the coxib eaters, takers. And you can see that when only 4,000, few thousand patients use the coxibs, even when only just few hundred patients try the coxib, it seems, according to the result, that maybe eating the coxib can be beneficial and can prevent myocardial infarction. When we reach the 10,000 or almost 5,000, it seems that maybe some problems can happen. And when we reach the 10,000 patients, it was obvious that those who are taking this coxib can have a higher risk for myocardial infarction. So it means, and that's why the trials are very important, and that's why that even a drug is registered and introduced in the therapy, we have to follow the side effects, because sometimes the side effects can revealed after 10,000 probes. And it's very, very frightening, but we have to be careful. Of course, if they will be enough alert, this problem could be prevented, not by the experiences, but there were animal studies. You know, in this genetic area, many things can be done, and rats or mice can be produced without cyclooxygenase 1 or cyclooxygenase 2, these called knockout animals. So there is no genes for cyclooxygenase 1 or cyclooxygenase 2, and they investigated these animals, and they found that the theory was that cyclooxygenase is necessary for life, cyclooxygenase 1 is necessary for life, the COX-2 is just for illness. And when they disappeared the genes which is responsible for the synthesis of COX-1, they did not find in animal studies any ulcer, any kidney problems. And it would be a warn that maybe the cyclooxygenase 1 is not only for the normal condition, but if there is no cyclooxygenase 1, there is some other mechanism which will protect the stomach, which will protect the kidney. And when they knocked out the cyclooxygenase 2 from the animals, they found that even a cyclooxygenase 1 inhibitor or non-selective cyclooxygenase inhibitor can reduce inflammation. And even in these animals, inflammation can be induced. It was in the animal files, and when they looked back for the animal files, they found that these animal studies had a message that they didn't understand or didn't want to understand. And basically, the story is that there was a hypothesis that cyclooxygenase 2 only created in pathophysiological conditions, but it's not true. Partially it is true. Cyclooxygenase 2 level is very high in inflammation, but beside this thing, the cyclooxygenase 2 is necessary for the synthesis of prostacyclin, which reduce the platelet aggregation. And if we block it for months, it means that people will die or get myocardial infarction, even arrhythmia and some other problems. So, what are the lessons that we can study from this story? If we discover, and this is the limitation of pharmacotherapy and pharmacology, if we discover a new mechanism, it doesn't mean that we have discovered all the aspects of the mechanism, because life is very complicated. God is the creator, And we just try to understand what is life and what is human body and how it is work, and we don't know everything. Even if it seems that we found something basic, we have to be careful, always have to be careful. It's a very important lesson. The next one, if the side effects of the new medicine should be, the side effects of the medicine should be managed very carefully and have to be follow up. And very important, it's a financial thing, but you understand that if $1 billion was spent and the drug bring huge income, maybe these things can cause some problems in the evaluation of threatening things during the therapy. So finally, I just show you 3 examples how medicine and lifestyle helps to maintain the health. The first example is hypertension. Hypertension is a very regular and very frequent disease, and we have to say that if somebody has a moderately severe hypertension, it means that those patients should take medication, not only change the lifestyle, but should take medication. And there are some patients who change the lifestyle, but their blood pressure cannot be normalized. It could happen. So don't believe that if somebody has a high blood pressure and change the food and change the lifestyle, it's sure that the blood pressure will normalize. There is a good results to normalize the blood pressure, but it's not sure. And in this case, maybe a drug should be taken, but the lifestyle should be continued. So lifestyle and medicine together can provide a healthy condition. And of course, the prevention is lifestyle to prevent the hypertension. The other thing is diabetes mellitus. You know, diabetes mellitus sometimes reach the old persons, yes, like the David sculpture. It's a very interesting disease. Do you know what does it mean, diabetes mellitus? Because there are 2 types of diabetes mellitus and diabetes insipidus. Diabetes means basically to standing in stride, this position, because it's an old nomination of the disease, because especially for males, of course, because when you are standing in stride, it's easy to urinate, because the basic problem with the disease is that you have lots of urine. Standing always in stride, because before there was no medication in a diabetes mellitus, you have to urinate 6, 8, 10 liters of urine, and of course you have to drink the water. So like a hole in your body, you drink the water and it immediately goes out. So diabetes means that you have lots of urine, and because of this problem you have a special body position. The mellitus means comes from the Latin word mel, which means honey. So the diabetes mellitus is the honey urination. And the other type of diabetes, which is not belongs to the or related to the high glucose level, but it has a hormonal, pituitary hormonal problems. This is insipidus. Insipidus means tasteless. So this is a tasteless urination. And this reflects that how the old physicians determined and distinguished the 2 diseases. When they tasted the urine of the patient and it was sweet, it was the diabetes mellitus. And when there was no taste, it was the diabetes insipidus. The sign is the same, lots of urine and lots of water to drink, but the taste is different. Fortunately, today there are more developed diagnostic way, but if you are in the tropical area or the rainforest and you have suspect there is a problem, if you taste the urine of the patient, you will decide that this is mellitus or insipidus. So in diabetes mellitus, of course, there is lifestyle and there is medication or medicine. Even if you have type 1 diabetes, you have to take insulin or use insulin, no other choice. If you have type 2 diabetes, you can use the oral antidiabetics. But even if you have to use insulin or take oral antidiabetics, there is no such an antidiabetic medication with which you cannot, you should not follow a healthy lifestyle. if you do not follow a healthy lifestyle, eat low sugar compounds, do exercise, take care of your body weight, because basically the diabetes mellitus, the second type of diabetes, is caused by obesity. This is the main reason, because you know the fat cells requires 4 times higher amount of insulin to take the blood sugar than the muscle cells. That's why if you are fat for decades, it will kill your pancreatic gland and there will be not enough insulin to take up the blood glucose. So if you do not follow, or the patient does not follow the healthy lifestyle guidelines, there is no such an anti-diabetic preparation, even the most modern, which can normalize the blood sugar level. So in this field, it also works together. And of course, we can prevent the second variation of diabetes. And the third one is depression. We mentioned it today. Without medication, a very severe depression cannot be treated. It's unavoidable to give medicine in a severe depression. And of course, we have to find the life factors which lead to depression. To come out from depression, maybe medicine is surely necessary for initiation, and after a lifestyle change, even physically, even spiritually, is necessary to prevent this disease. Final conclusions, and we are 6 o'clock, so it's okay. But of course, if you have questions, you can ask it a little bit. So final conclusions. We can say that pharmacology and the scientific investigations is an essential part of the evidence-based medicine. Pharmacotherapy, and it's very important, pharmacotherapy cannot substitute lifestyle, but the two parts should work together. We always have to follow the prescription and to avoid the toxic effect and reach the higher therapeutic benefit. But in spite of these facts, we should remain trust in God, even taking the medicines, because God is the healer, but God gives us tools to promote our healing. So finally, and that's the text which was cited by Peter Landless at the morning session, God says in Jeremiah 33, verse 6, that nevertheless I will bring health and healing to it. God provides us very various way of healing, and I believe that the pharmacology and the drugs, the medicines belongs to this part, belongs to this healing arsenal of God. And he said, I will heal my people, I will let them enjoy abundant peace and security. And what I talk about this afternoon, and also Marek mentioned it, that in medicine, in spite of the side effects and the risk, but we can have a security that these are very detailed examinations which try to reveal all the problems, but we have to be careful. So therefore, I think it's a good summary for this section this afternoon, that God brings the healing, God gives the possibilities to heal, and God gives the methods, and I am convinced that even medicines belongs to this field. Thank you very much.